have enough time for our panelists to respond. My name is Sharon Roberson, and I'm President and CEO of the YWCA Nashville Middle Tennessee. You are now, we are working in our Stand Against Racism series, and Stand Against Racism has been a part of the YW for some time. We decided a few years ago that we would expand this so we would have these community conversations around significant issues regarding the part of our mission that states that we are here to eliminate racism, empower women, and also to promote peace, justice, freedom, and dignity for all. Today's topic, racism, COVID-19, access to care. And we do believe that some of the issues that we are seeing that have been escalated through COVID-19 have always been there in a system that tends to marginalize people of color, and this is a healthcare system. Before I get started, I would love to thank our presenting sponsor, Regions Bank. They made a decision that they would sponsor our entire Stand Against Racism series because they felt as though these conversations in the safe space of the YWCA would be significant and would benefit our community. I would also thank Allstate, that is our peace sponsor. They too have stood with us in this journey in making sure that the public is aware of these significant issues. I thank Janie Greenwood Harris, who is the chair of our advocacy committee that made sure that we do push forward in a very important aspect of our mission. Last year, our Stand Against Racism series covered issues such as immigration, criminal justice, and also somewhat of the civil rights movement history in the city of Nashville. Today, we're moving forward in our next tier, which is healthcare. We will hear about the work of the Tennessee Justice Center, Vanderbilt Meharry Alliance, Birth Manifesta, LLC, Otsuka Pharmaceuticals, and Siloam Health as they lead fight for the health and well-being of people of color in our community. I will then start asking questions of each of our panelists. They will introduce themselves and they will tell us a little bit about their organizations. They will also describe the overall relationship between the healthcare system and the communities with which they work. I will start with Dr. Consuelo Wilkins.
Thank you so much, Sharon. My name is Consuelo Wilkins. I am a physician and researcher. I'm currently the executive director of the Meharry Vanderbilt Alliance, which is a partnership more than 20 years old now between two academic medical centers here, which we're lucky to have in Nashville, Meharry Medical College and Vanderbilt University Medical Center. And so my experience and the opportunities around interacting with the communities during this crisis have been, in part in that individual organization in the middle, but also involved in both Meharry and Vanderbilt. I think it's a unique time, an important time for us as healthcare organizations to consider what it means to be really organizations that are at the forefront of providing access to testing and then also participating and doing research. So research is really critical for a condition like COVID-19 where there had been no proven effective treatment when this virus was first identified. And the disproportionate impact on communities of color has been, shocking in many ways. So, what the relationship is with communities, though, is really dates back many, many generations. The legacy of distrust and research abuse, but also segregated care still has remnants today in how we deliver care, where testing would have been provided, opportunities to access information, and of course, whether or not communities of color actually trust the information that they're getting from us. So I'll stop there and say again, thank you for allowing us to have the opportunity to talk about these important legacies that still impact health.
Thank you.
Hi, good afternoon, everyone. My name is Dr. Celia Ezidiegwu. As Sharon had mentioned, I work currently at Otsuka Pharmaceuticals as a pharmacovigilance physician. My specialty is preventive medicine, and as such, I'm currently on the COVID-19 task force within our organization. My specific branch of the work that I'm doing there for that is in occupational health and safety. And it speaks to a very specific interest I have with regards to public health and ensuring the safety of workers. And I hope for us to explore a little bit of that in this conversation today. Thank you.
Good afternoon. My name is Tanzye Hill. I am a full spectrum doula, a holistic educator, and a mentoring doula as well. I'm the founder and owner of Manifesta LLC. We support women and birthing people along the pregnancy continuum from conception through postpartum, and focus on centering the voices and choices of women and protecting the maternal memory. Our relationship at Birth Manifesta with the healthcare system is facilitating conversations with providers, educating and advocating clients on their birth rights, and helping them have a voice in the conversation around maternal health. And I also will just stop a little bit right there, and we can get more into maternal health in a minute. Thank you for having me.
Good afternoon. My name is Betsy Swan. I'm the Community Health Manager at Siloam Health. Siloam is a faith-based nonprofit healthcare organization that is located here in Nashville. We have 2 locations, one in Melrose and one in Antioch, and we serve the uninsured and culturally marginalized. Our specific focus, while we will serve, like I said, the uninsured population, we specialize in serving the immigrant and refugee populations in Nashville. So more than 90% of our patients come from an immigrant background, representing over 80 homelands and 70 different languages. And so as a result, you can imagine that our patient population has a wide variety of experiences with the healthcare system. Depending on their home country, they may have come from a context where their healthcare was completely free and accessible in their home country, or they may have not been to a doctor in decades because they had no access to a doctor in their home country. So one of the main things that I do in my work is I lead a team of community health workers who help serve as that bridge and build trust between the immigrant and refugee communities and the healthcare system here in the United States.
Hi everyone, I'm Kanika Young. I'm the Senior Director of Health Policy and Advocacy at the Tennessee Justice Center. TJC is a nonprofit organization that works to keep leaders accountable and make our healthcare system responsive to the needs of Tennesseans. We do that in several ways. One is through our direct client work. We help low-income individuals and families, people with disabilities, and older adults navigate our public benefit programs. So that includes Medicaid, CHIP, SNAP, and WIC. We also do advocacy work and we do litigation. We are a law firm. I'm a lawyer by trade. And so we use litigation as one of our tools to advocate for systemic changes to help improve access to healthcare and nutrition on behalf of all Tennesseans. We also do lobbying, both grassroots and direct lobbying, to organize the voices of Tennesseans and help them to champion the change that they want to see in our healthcare system. And the way that that has played out during the pandemic specifically has been in very early on, we advocated for our Medicaid program, which is known as Tenncare in Tennessee, to pause terminations of people who are currently enrolled in the program so that they would have continuous coverage and access to healthcare during this public health emergency. We have also been leading the work to make sure that the Pandemic Ebt Funds have been distributed across our state. We have a nutrition team that's been working hard on making sure that those funds actually get into the hands of the families with school-age children who need that money for assistance with putting food on the table. And we are continuing to lead work on getting our state to expand Medicaid so that people who are in the coverage gap can have access to healthcare, and also to provide some much needed fiscal support to our state during this economic downturn. And then lastly, we do training. So we work with other organizations that provide services to the community. That includes healthcare providers, navigators, and other types of social service workers so that they can get the benefit of our knowledge about the red tape and how to navigate the systems that are supposed to be helping the people that they serve. And thank you for having me today.
Thank you. Now, in your introductions, each of you discussed really what I see is, your pain points, whether it's education, whether it's, access to Medicaid expansion, whether it's maternal health, those sorts of things. So in answering and asking the next question, I'm going to start and do things in the reverse. So I'll start with you, Ms. Young Kanika. Where do you see and experience racism? Because we're talking about healthcare, but we're also talking about how it adversely affects people of color. Where do you see and experience racism in the realm of public health in your work? What barriers do you see facing Black people and other people of color, BIPOC, and what has changed since the pandemic? I'll start with you, Kanika.
I will try to be brief in my remarks, but have a lot to say about this topic. But I think what we are trying to educate people about, specifically as it relates to racism, is that systemic racism and discrimination are directly linked to poor health outcomes for Black people and communities of color. Dating back to the beginning of this nation, health disparities have existed and have plagued Black people and other people of color as a result of systemic racism, which influences every social determinant of health and really explains why people of color have disproportionately higher rates of infection, hospitalization, and death from COVID-19. And so when I talk about social determinants of health, there are a few that are specifically at play during this pandemic. One is access to certain types of employment. We know that employment discrimination has been an issue in this country for many years. And so when you think about the fact that 43% of Black and Latino people work frontline jobs and cannot telecommute, compare that to about 25% of white workers. So off the bat, you have people of color who have greater exposure to the virus just simply because of the types of jobs that they have. The second thing I think is affordable housing. Housing discrimination is another area that I don't need to explain to anyone on this call. We know that that has been an issue dating back to, we can point to policies such as redlining that were popular in the 1930s that have really persisted to today, and we still see segregated neighborhoods. And you have issues in terms of people of color making far lower incomes compared to white people. And because of those income constraints, Black and Latino people are more likely to live in close quarters with multiple people, often including 3 generations in one household. That makes social distancing or isolation very challenging for those communities. And then the third area that I would mention in terms of the social determinants of health that are linked to racism would be in transportation. Black and Latino people are more likely to take public transportation or share rides simply because they may not be able to afford their own cars. And it's noted that there have been clusters specifically in Nashville among construction workers, and that's been traced to co-workers riding in the same vehicles to and from their work sites. So all of these social factors can be traced to racism, discrimination, and segregation, and those things have been sanctioned by our government to varying degrees throughout history.
Well, thank you. Betsy?
Yes, in addition to all the social determinants of health that our colleague just explained there, I would add that the system is set up for people who speak English and understand English as their native language. I can speak from my own experience as being a native-born American. I speak English. I have trouble understanding the healthcare system sometimes. And so I can only imagine what it is like for someone who has come to the United States either recently or for several years in the past, trying to navigate and understand how to access insurance or how to properly use the emergency room, or how to get a PCP, how to find the proper ways to, when should I go to a walk-in clinic, when should I wait and go to my regularly scheduled PCP appointment. All of these things, this information is typically communicated. Like I said, it's set up for people who speak English. And this has only been exacerbated in the height of the pandemic, for sure. So we have seen being able to put out our public information about testing sites and when how to get treatment and how to isolate and how to quarantine properly, making all of those resources available in the native languages of the immigrant populations that we serve. Because there are two levels here. No, there's understanding and then there's circumstances. And so we can start working on the understanding by just the basics of making things available in languages, in the native languages of the immigrant and refugee populations in Nashville. But then also doing the next step of addressing those circumstances in the social determinants of health as well, that we have seen, whether that's making sure that the employers who have a patient who has tested positive for COVID, that employer does respect that patient's need to stay home and isolate or quarantine, or understanding how a patient might need to stay home, but they can't because they're the only one who works in the home. Things like that have, again, just been amplified in the context of a pandemic. These were issues that are kind of built into the fabric of the American healthcare system, as was previously mentioned, but due to everything that's going on and how many people are getting sick frequently, we're seeing all of this kind of put under a microscope at the moment.
Hi, so I think I would start by mentioning, pre-pandemic, we had a Black maternal mortality crisis in this country. So Black women are 4 to 5 times more likely to die during childbirth than white women or women of any other, ethnicity or race. And is when the pandemic began, one of the first things that happened, to reduce the spread of the virus was the kicking out of birth workers and support people for women that were going into labor and going to deliver in hospitals. This was because of the spread of the virus, but really had to do with us not having enough protective gear, protective, equipment for everyone that was coming into the hospitals. And when you look at Black communities, and I would say brown communities as well, and we think about pregnancy and laboring and birthing and safety, immediately this impacted our communities because we are communal communities. When we come with the grandmother, we come with the cousins, we come with everyone, right? And that is how traditionally we have birth in this country and around the world. And so immediately you're gonna see an increase in stress and fear, that's gonna impact birthing moms throughout this pandemic as a result of the again, restricting the individuals that were to come into the hospitals. In addition to that, just as far as my work in maternal health and being on the front lines in the hospitals, in birthing centers with mothers, and our organization specifically, we do have a focus. We serve all women, but we have a focus on Black mothers because of the mortality crisis. And the way we witness experiencing racism is looking like neglect. There's a long history, and it's still being taught in medical schools today, that Black women have a higher pain tolerance than other women. And this is completely false. We should know this, right? And so what you see, what I experience with clients is, you know, them not being taken seriously when they are requesting pain medications, neglect in the form of they, you know, they're not prioritized based on, you know, what they are experiencing. They're not being believed. They have longer waiting times. And as Dr. Wilkins talked about in the beginning, there's just a general distrust between the healthcare system, again, as Kanika touched on, because of long lineage of, you know, experimentation on Black bodies, and specifically a whole, you know, field in medicine, gynecology, and oncology that is rooted and founded on the experimentation of Black women. And so that, I mean, that plays a part today. Like, we know epigenetics is real and present, and that trauma transfers from generation to generation. And so when we look at in maternal health, you know, and being pregnant, I would also just add, you know, we're in a COVID pandemic, but we're also in, you know, a racism pandemic that was already there. And so I have to speak Breonna Taylor's name today, and the fact that Black women all over the world right now, you know, all over our country have an increased sense of stress, I would say, and trauma, as a result of Breonna not getting justice, and it's signaling that Black women are not, you know, don't matter, our lives don't matter. And so you can only imagine being pregnant in a time like this right now, and having to witness these headlines and this lack of justice that is happening in Black communities.
Hi, and thank you guys for making these excellent points. And you both touched on a lot that is very much so significant and relevant to what's happening with Black people on a whole, and also with women. And Kanika, the point that you brought up earlier with regards to occupation is very near and dear to my heart. And you hit the points right on there, especially when we speak to the intersection of occupational security. You know, one of the areas that I like to think about when I think of public health are theoretical frameworks. That's kind of how we frame how we look at communities that we serve. As a preventive medicine physician working actively now in securing occupational safety for employees that will be working in manufacturing capacity and the labs for our pharmaceutical company, I also think beyond that and look to see what's happening with the people most affected, which are our people of color, specifically Black people. And when we look to those numbers, we see that many of the Black people fall into, rather, there are three buckets of employment right now when we look at the pandemic. Those who are unemployed, those who are essential healthcare workers, and those who are working from home. Now, for those who are unemployed, that creates a very, very, very important issue, especially for Black people, because one of the Economic Policy Institute did call two significant risk factors for COVID-19 in people of color, and that is racism and economic inequality. And when you recognize that there are people who are unemployed, what does that mean? The unemployed status for a Black person is very different than what it is to be a white person. If you are unemployed and Black, to the point that was made earlier, there is a wider economic gap. There's also, as a result of that, less liquid cash. So people are strapped at this time. And as you are living in circumstances like that, especially in homes that are multi-generational, where there tend to be single income earners, that creates a higher incidence of stress. And to your point, Tanzye, for women especially, this is relevant. Even if you are not someone that is pregnant, if you are living in this sort of situation, it impacts us yet at even a higher rate, truthfully, because the numbers are that more Black women are unemployed than Black men, while Black people as a total are unemployed at a higher rate during this time period. So this systemic issue then now impacts Black women even more significantly, especially when you have a higher number of single income earners being women in the Black community. Then next to that, when we think of frontline workers, there is a large number of frontline workers that are Black. And more than just, when we think of frontline workers, oftentimes for people, we think of people in the traditional heroic roles of being officers or physicians or your EMTs, but these also include the people at the grocery store. Everywhere that you walk outside, that you see someone and you encounter them providing a service of any sort, that is an essential worker. So these are your postal workers, the people working at the convenience stations, the people working at the gas stations that you go to as well, people working transit services. For myself, I'm located in the New York metro area, specifically in Central Jersey. These are people working the transit systems. These are people operating our subways. These are the people that almost the invisible scene, right? So when we even think of hospitals, a large number of the people that are impacted in this community are those cleaning, the orderlies in the hospitals. When PPE is distributed, which is essential personal protective equipment, we're giving it oftentimes to people like myself, physicians who are on the front line seeing the patients. Well, how much is this PPE being distributed to people that are working in some of these less visible roles? And what is the impact? What is the impact to these individuals when, to the point that you make, Kanika, they go back home to their more densely populated centers? They are also in multi-generational homes. You're bringing back the infection into your home and then further into the community that you reside within. So the intersection of racism and this pandemic is so far-reaching, and it literally strikes a chord in every area that you can possibly speak to when we think about life as a whole. And before I pass the baton on to Dr. Wilkins, I think of the Maslow's hierarchy of needs. And this is a theoretical framework that supports the idea of having your basic needs met up through the pinnacle of self-actualization. So we start with our physiological needs, which is air, water, shelter, food. We move next to our security. And security includes access to resources, employment as well. These two equate what we do, or rather define what we look at as like your basic needs. Then from there we have love, self-esteem, or esteem, which includes self-esteem and respect for others. And then finally, self-actualization. Do you think when your basic needs are not being met, specifically your employment status is not being secured, or you feel unsafe in your environment, or you don't even have a job to speak of, do you believe that it's possible to reach that moment of self-actualization? It's difficult. It's very difficult. And I definitely want to make sure that as we are moving forward and thinking about ways to improve, that we are also thinking about the invisible that are clearly making a lot of our lives work in this time. Thank you.
Well, thanks to my esteemed panelists for saying so many great things and making me have to dig deep for something that you didn't cover already. So I do think that it's critical for us to recognize that at the foundation of medicine and healthcare, especially in the United States, there is racism. So we're talking so much about COVID-19 and all of the disparities that are impacting racialized and minoritized communities. But there's this piece that I think we often get wrong. And so the emphasis on the social determinants and the social structures that are really driving these disparities is important. But what did we start to hear shortly after we saw all of the disparities being discovered among Black and Latinx and Indigenous populations? All of a sudden, people were less concerned about it and sort of ready to go on about their business because it was only affecting these marginalized groups of people. And then how soon after did we start to hear that, oh, it's because they are sick, they have diabetes, they have hypertension, and that's what's wrong with them, it's their fault. And so this biologization of race that has happened that really underpins that and doesn't allow us to recognize that the reason that communities of color, Black people, have more health disparities at the beginning is these social determinants and the structures and the racism and the disinvestments in our communities, so that we are stressed and discriminated against and experiencing racism. So our biology changes because of that. We our immune system doesn't function the same way. We don't metabolize glucose the same way. Our blood pressure is increased. And so all of these things we experience, these chronic conditions, are because of racism and discrimination and how structures are in place to keep us oppressed and disadvantaged. That's why we have these chronic conditions. So to divorce that from the social circumstances and just say, oh, these people have these problems and that's why they're disproportionately impacted, is at the seat of, again, how medicine and healthcare operate and continue to disadvantage our communities. And so I think that aspect of racism is so built into the structure and the system that we don't think about it at all. And then, of course, as we're thinking about how to, prevent COVID-19 moving forward, and vaccines and vaccine development and the studies and the trials all being developed without really critical input from communities of color, and what this should look like, the protocols, the design, and of course the inclusion of these communities in the actual research before we get to a point of even saying now it's available, everybody should take it. We've missed so many steps to even get to this point to think about how to move forward.
Thank you. We have some very important, I've received already 5 questions, so I want to have some time to get to those questions, but this is fabulous. We've talked about some things that are missing, some needs of the community. What do we have that is available, some sort of help that's out there, even if it's not what we want or less than what we need? What kind of help is available? I'll start with you, Consuelo Wilkins, Dr. Wilkins.
Well, I think very importantly, thinking about the resources and the testing that's been available at Meharry, through Meharry, the community testing sites, and that's certainly been done in partnership with the Metro Department of Health. But those opportunities where Meharry has actually been going out to churches and doing this in communities, I think is really very important and a step towards breaking down some of those barriers to access. And so if you look at where testing was available initially, there certainly hasn't been available in all communities, in all areas of Nashville, and certainly not, in North Nashville, at least beyond sort of the inner corridor. And expanding that and finding out where you can get testing, I think is really very important. Betsy mentioned the resources available in multiple languages. Vanderbilt has seen disproportionately people who speak languages other than English being impacted, and at one point more than 2/3 of the patients admitted to Vanderbilt with COVID-19 spoke a language other than English. And so a lot of resources have been developed there to help people understand how to take care of themselves, what to do if they are impacted, but also to try and really get ahead of some of the misinformation and disinformation. And a lot of that we've actually tried to do by partnering with community organizations, because we have to recognize that the trust is in the community, and not always, and sometimes, rarely within the health systems, especially large health systems. So making sure that we are partnering with community organizations to share information, but also support them as they provide that information.
And I think, with regards to employment, one of the best ways to be resources that I can recommend, and to your point, Sharon, it may not necessarily be where you want to go, but because it's government related, but it's important to be informed. So I would absolutely say, be aware, go online. If you have access to a computer or phone, any mobile device, go onto your state's Department of Labor site and see what resources are available to you. They give up-to-date notifications as to how laws are changing and what financial assistance is available. I know actually recently in New Jersey, the limited assistance, the LWA funding $300 additional stipend that was provided for unemployed citizens of New Jersey has been extended. Now, I believe in Tennessee that has stopped as of September 15th, but it's still worthwhile to know how these changes are happening. Also, too important, know what your rights are. These are, if there's anywhere that you can find the rights of yourself and those of your employers, it's not on Instagram. Instagram may give you the point you in the right direction of where to go. Social media may give you some idea, but the true laws are on the websites of your state Department of Labor. And additionally to there, you can also find resources for when you find that there may be some issues going on with your employer, with your site of work, the safety in returning to work if you've been working from home and have now been recalled. Find out what the measures are there. And then also to your Occupational Safety and Health Administrative site, specifically in Tennessee, that's TOSHA. So TOSHA.gov, that can give you information too, specific to your line of employment with regards to your rights and how laws are changing.
As it relates to like maternal health, I'll give three, I guess my top three resources. One that I'm very excited about is an app that is launching this fall, created by a woman by the name of Kimberly Seals Ehlers, and she is the author of The Big Letdown, a book on breastfeeding, and she has created an app called the Earth app, IRTH, and it is Birth Without the Bias, and that app is gonna function like a Yelp for doctors and hospitals. Where, you know, people can go and have a space to share about their experiences in the healthcare system, because there needs to be some accountability, right? And people want to know, like, where can they go, where are there providers that are, you know, doing anti-racist work and providing safe experiences for mothers. So the Earth app is coming soon. You can look that up. There's a whole website as well. March of Dimes is a wonderful organization, you know, working around infant mortality and maternal mortality, and has a slew of resources, especially around birthing during COVID. And also pregnancy planning, you know, what to expect, birth rights, all of that. And the last one will be the National Birth Equity Collaborative that is also doing research and work around Black maternal health and mortality.
Thank you.
Thinking specifically about populations that might have distrust in the healthcare system, which, as we've mentioned here, is common in populations of color. One of the strongest and most effective ways to address that distrust is by dispatching community health workers. And that, as I've mentioned, is what we do as the community health team at Siloam. So a community health worker is a frontline individual who comes from the community that they serve. So for example, my team is made up of people who come from immigrant and refugee backgrounds who are language matched and serve those same languages that they come from. And community health workers, or CHWs as we refer to them, serve as that trusted source of information and that navigator or that bridge with the healthcare system. And Siloam, as a part of our response to the pandemic, entered into partnership with the Metro Public Health Department to create a team of community health workers as part of the COVID response. So Siloam has had a community health worker program for the past 5 years or so. But so in that sense, this is nothing new, but now it's COVID specific. And so this team works with patients for about 3 weeks. These are COVID positive individuals, and helps them achieve the goal of successfully isolating or quarantine at home. And so the way to get in touch with our community health worker team, we have a hotline set up that I can share that number with you, but our team serves Spanish speakers, Arabic speakers, Nepali speakers, Burmese speakers, and a variety of other languages that come to us straight from the health department the case monitors for COVID positive cases. We see that our community health workers, they really do address those social determinants of health. So they deliver food boxes, or they help people get a letter for their employer that allows them to go back to work, or they help them figure out their internet issues because all of their children are at home having to do virtual school, and all of these things that's helping to stop the spread of the pandemic. So again, we have a phone number that is specifically to help people connect to a Metro Health Department community health worker. We can send this out later as well, but I'll just put it out, just give you all the numbers now. That's going to be 615-651-4904. Other places of information for COVID-19, the health department, the Metro Nashville Public Health Department has a COVID hotline that is manned in order to answer questions about where's the testing site, where should I get tested, I'm experiencing such and such symptoms, what should I do? But then there's also a Spanish language specific COVID hotline that is manned by Conexión Américas. So again, we'll send this number out because I don't want to just give you all a big long list of phone numbers, but the health department hotline in English is 615-862-7777. And the Spanish equivalent is 615-326-9986. So we are trying to make things as accessible as possible to give people the resources they need in order to fight COVID successfully.
I think the main resource that I would like to uplift in response to this question is my organization, the Tennessee Justice Center. We have been really trying to gather the resources that people need during this time, specifically health insurance, food assistance, and information about unemployment benefits. You can find all of that information on our website at tnjustice.org. We have a page that's specifically dedicated to COVID-19 updates, and a page that's called Find Assistance for people who are looking for that information. And I would just like to stress that because of the economic recession that we're experiencing right now, there are a lot of families who are eligible for public assistance programs for the first time in their lives, and they have no idea how to navigate these systems. And so we want to make sure that the information is available to people who need assistance with health insurance, with food assistance, and what have you, so that they are not struggling without any place to turn. And I would hope that people can consider these programs as safety net programs. They are there for exactly these occasions when you find yourself not being able to meet your basic needs, and you need that safety net to help you until we can recover from this time in our country. And so a couple of things that we have been really focused on in helping people to stay healthy during this time is focusing on our Tenncare program as a resource for health insurance. So I want everyone to know that because of the declaration of the public health crisis, the state has paused terminations of people as of March 17th. So if you were already enrolled in Tenncare as of March 17th, you cannot be terminated involuntarily. The only basis to terminate is if you move out of state or if you die. But if you have a change in circumstance, that cannot be used to change your eligibility status during this time. And that is at least until the end of October, which is the current period of our public health emergency in the country. And then the other piece of information I think is really critical is the Pandemic Ebt Funds that are available. These are additional monies that are available to families with school-age children who would be receiving free or reduced price meals at school. Because schools are closed and children are home with their families, there is an increased expense for feeding the families. And so Pandemic Ebt funds are intended to help families through that time. So if you live in a district where the school is closed for I think at least 5 days, then you are eligible to receive this money. And even if your school is offering a hybrid model where you can choose to go in person or stay at home, if you choose to keep your kids at home, you can receive these monies. So I just encourage people to go to our website. Again, that's tnjustice.org to get more information about these public assistance programs that are available.
And thank you. And we will be sending out information about each of these resources to you. But also, I also want everyone to know the full bio of this wonderful panel, because as you see, they know what they're talking about and they are resources in and of themselves for our community. Now we're going to get to what I call the fun part of the panel. And this is really asking you what I call the real questions. And we had a question that said, should we be more engaged in trial studies? What strategies can impart some level of trust? And this is important because there's often this view that people don't do things because they don't trust the system. But I truly understand why there would be mistrust. I also want to add a little twist to that question. Now I want each of you to respond to this. Would you take a COVID-19 vaccine that was available before 2021? So I'll start with you, Kanika.
It's interesting that you asked that question. I was just watching an interview that Dr. Fauci did the other day, where he talked about when he would feel comfortable taking a vaccine, and that would be when there's been sufficient testing to show that it's effective, and sufficient time to show that there aren't adverse reactions to the vaccine during the trials. I don't know what the magic number is in terms of the number of days, but I can't imagine that we would get there before the end of the year. So unless Dr. Fauci says the vaccine is safe, I'm not taking it.
All right, Betsy.
I would say something similar. I would say as long as the vaccine has met all of the requirements, I would feel comfortable taking it. But at this point, I know that the research is still very much in process. So I will wait until we see the final results.
Okay. Are there trust issues? I guess I see there are. I guess there are quasi-trust issues. Let's move on. Let someone else respond.
I think I have to agree with Kanika and Betsy. My personal preference is not that of vaccinations, but in general, I think along with the numbers, the proper representation from all races, all genders in the testing, I feel like would be necessary before we get to a place where, or for me, where I get to a place, where I would take the vaccine. But I mean, I have to be authentic to myself in that I'm a pretty holistic person. So that's not something that, I'm looking forward to partaking in.
Hi, everybody. So I think to answer the first part of your question, if people should join in clinical trials, I feel that clinical trials, especially for people of color, I know the history of why Black people specifically are not interested in being what would be called, like guinea pigs or tested on. I think clinical trials as a whole, we do need to see more of our numbers going up in that space. The reason I say that is because as a drug safety physician, I look at the adverse effects of different drugs. And when we are looking at that, that's how we come up with our safety profile. Along with the trial study that happens during that time, we also look at what's happened. We look at the post-marketing data, and we also look at what we find during the clinical trials. When studies are conducted with subjects who are predominantly white or male, we know what the profile of these medications look like in people who are predominantly white or male. Or just not Black. So when we don't have enough people enrolled in studies where we are actually looking to see how drugs are working, we don't really know how they impact us until we're taking them, until they've already been deemed safe. And we find a whole set of adverse events later on down the line. So with that in mind, I can personally say that I'm not wholly averse to people, especially people of color, joining studies, because that's how we learn more about what's happening. And also trusting that, you know, doing the due diligence of being in touch with a clinician or reading up on the organization that's conducting the trial to make sure that there are specific safety measures along the way. Now, with regard to this COVID vaccine, I have a different stance on that. I think that it's important that we do our due diligence to make sure that it's safe. I agree with Dr. Fauci. It is, especially as a drug safety physician, we need to have enough results to see what's happening, to really call a safety profile. If we don't know what the adverse events are, how would we know? How would we know what's normal to be expected with the drug or what actually are signs of impending death? You know, we really wouldn't be able to discern the two. So to answer your question, Sharon, no, I would not recommend or myself take a vaccine before the new year.
I'll just add on the trust piece that certainly I think that it's really unrealistic to ask Black communities and Indigenous communities and other communities who've been, you know, historically abused in clinical trials to just trust. I do think a critical piece of that is transparency. So if there is no proven effective drug for COVID-19. Now we have some treatments now, they're primarily for people who are inpatients, but, you know, hospitalized. But if we're really trying to, at some point we have to say, okay, will we allow ourselves to continue to be disproportionately impacted, or will we actually make sure that we're not left out of the opportunity to have a vaccine? And so I think it is important for us to be involved, and there need to be some oversights in place. So transparency is the key for that. So who's on the oversight committee? Who's reviewing the data? You know, how many people are enrolled? Are the adverse events really disproportionately impacting one group over another? I think we have to have that kind of oversight and evaluation of the data. And of course, we saw with the CDC early on that there was a lot of missing data, no race, ethnicity data available. You know, that's just really, you know, can't happen. So what is happening? Can we see the data? Can people that we trust see the data who can help evaluate it and communicate it with the communities? I think is all really important. Would I take a vaccine before, you know, before 2021? I would definitely say we have to see the data, and instead of Dr. Fauci, I would say I don't want Dr. James Hildreth, who's president of Meharry and an immunologist, and Dr. David Aronoff, who's the chief of infectious disease at Vanderbilt, to tell me it's okay. Because I will take it. I just want to know that the people that I trust and who I think are trustworthy say it's okay. Not that Dr. Fauci isn't, I just worry that sometimes he doesn't get to say, we don't get to hear what he has to say.
Yeah, very good. Okay, we're near the end of our time, but we do have some questions. So I'm trying to summarize to make sure everyone touches on this. I do want each of you in your response to give us some sort of call to action. If you could tell this group, and we have 114 people on this call, which is a lot of people, to give them some sort of advice or information. So I do want you to touch on that. But that within your response, I want you to really look at what would universal health care, being able to have universal coverage. I'm not just talking about, you know, either Tenncare or what. I'm talking about everyone could just go to the doctor and receive adequate health care. What a change that would make on tackling this issue. That would be a systemic change in tackling this issue of health care. And so I'll start with you, Dr. Wilkins.
So I think there's a false presumption that access to care is going to immediately change and fix things. It's not going to fix racism. It's not going to fix all the things that we've been talking about. It's not going to change, you know, doctors' views about, you know, Black people and misperceptions, and you know, it's not going to immediately make healthcare available in all communities. The doctor's offices haven't changed yet. We don't have enough healthcare professionals who are from diverse communities. Like there's so many other things that need to be fixed in the system to address racism, that, you know, just access to care alone is not going to be the only thing. Not that it's bad, but or that we shouldn't have it, but that we shouldn't think that giving people a card or access in that way is going to fix things. And so I think in my call to action, I would just encourage everyone to really stay armed with information that is accurate and seek out those trustworthy sources of information. And I know most of the panel has provided information, so hope you'll take it up.
Okay.
I would say my call to action to everyone listening in today would be to recognize and hear the experiences of the people around you, especially if you're working, be it either at home or in any setting. Be mindful of the experiences of the others in the settings with which you work, because you know, unemployment and employment in general, first of all, if you are employed and you are a person of color, you show up every day, either to your physical job or to your TC on a Zoom like this, and irrespective of what's going on outside, what the headlines are, you are impacted by this. And there isn't a time off. No one is given 30 minutes to mourn Breonna. No one is given the time to necessarily process what we heard in May going on in the Midwest. We don't have that opportunity. So I would say, as you are in your work settings, be sensitive to what is happening in the Black community. And then also too, use your voice. Use your voice. If you are, as a person of color, use your voice effectively for the change that you see in every setting that we occupy. You are a person of service. As a physician, as a doula, as a lawyer, whomever you are in service. If you work at the grocery store, you are in service. Be an advocate for those with whom you serve, and speak up when you see something going wrong. When more of us challenge ourselves to be vocal, change actually does happen. It's when we are allowing ourselves to stand out as outliers and we live in fear that we don't actually have opportunities to speak and to speak on the changes that are going on.
I think I would agree with Dr. Wilkins as far as while universal health care would be wonderful, it doesn't eliminate a lot of the barriers that Black and Brown communities are experiencing. And so from my seat, there's a lot of education that has to happen, right, to navigate the healthcare system. And those are the type of things, like picking providers, understanding that you have choices and that you should have consistent care. Like those things would have to also come alongside the universal care. And so with that, I would say, my call to action is really personal and professional, that everyone should be doing their own work around anti-racist work, because the system is racist. It is. And so this is not a political thing. There's no, this is very Black and white. You either you are working to dismantle the system, or you are upholding the system. And there's no gray area in that. And so I think my call to action is, whether it's in your personal life or in your professional setting, that we start putting these practices into place. And also that when this work is happening, that it's being led by people of color. And also validating their, not just their credentials, but also their lived experiences. Thank you for having me.
I would agree what was previously stated of making healthcare available doesn't necessarily mean that it's going to fix all the problems in the system. There's still going to be issues of mistrust within the community. And so one way of fighting that mistrust is to deploy more community health workers. And so that's part of my call to action for you all today. The Penn Center for Community Health Workers, which is located in Philadelphia, is collaborating with 7 lawmakers, 7 federal lawmakers, who are sending letters to the Department of Health and Human Services advocating to deploy more community health workers now in this COVID world that we live in. And this would result in improved public health. It would create jobs because, as I mentioned, community health workers come from the communities that they serve. And then it would also save people money in the long run. It would save the system money in the long run as well. So if we're looking at the personal, the health, and the economic impact, I would say that we need to deploy more community health workers in order to keep our country healthy long term. So as I said, the Penn Center for Community Health Workers is sending letters to our congressmen and representatives and senators. And so we can send out the link to join that petition for you and your organization to add your name to that movement that we've got going. Also, just thinking long term, what are some things that you can do? I would say interact with people who are different from you. So that means building relationships with, coming from my perspective, that means building relationships with immigrants and refugees, learning their stories, not just taking things that you hear on the news about immigration reform or immigration policy, but really getting to know people. Learn a language, build relationships with people who speak that language. All of these things can lead to a more equitable society.
Thank you.
My call to action to the audience, one would be to vote. If you need information about deadlines or how to request absentee ballots or where your voting locations are, you can visit the Tennessee Secretary of State website. They are the authority in the state on all matters related to voting. So please educate yourself and develop a plan to vote. It's very important that you do so now and for every election. And then the second thing that I would say is, while I agree that universal coverage or access to healthcare would not be a silver bullet to resolve all of the issues that we see, access to coverage is a significant step in the right direction, and our state is one of only 12 that is refusing to give that access to people, although it is available. And I would encourage people to educate themselves about the issue of Medicaid expansion, and you can find information again about that at the Tennessee Justice Center website. But I think people should understand that Medicaid expansion in states where they have expanded, racial disparities concerning access to care have been reduced as Black people and other people of color have gained health insurance. Steady coverage gives Black and Hispanic people the ability to develop and maintain long-term relationships with their physicians, and they are more likely to receive trusted medical advice if they have a steady source of coverage that allows them to maintain those relationships. They also can get information about available resources to address their social needs, as well as preventative services and consistent care to manage chronic conditions. So again, universal health care may not fix everything that's wrong with the system, but it is a significant step in the right direction. So I encourage people to join the fight and advocate for Medicaid expansion in Tennessee. And there is an event happening on October 1st that everyone is invited to attend. It is going to be broadcast on Facebook Live, and it will include Stacey Abrams and Reverend Dr. William Barber talking about Medicaid expansion. It is called Southerners for Medicaid Expansion. It's a coalition of the 8 Southern states that haven't expanded, and we're going to be sharing information that people really should know, and how the lack of expansion has impacted people in states across the South.
All right. Well, this was our panel for today, and this is everything that the YWCA hopes to do with these series. I want to say, if anyone is interested in understanding how to navigate a political process as far as Medicaid expansion or even otherwise, make sure you go to the Tennessee Justice Center's website. Also, all of these ladies, their bios, their organizations, they are here to help us. So this is really just the first step. I will close by saying that I was listening to a interview with Dr. Kendi, who writes the book, How to Be an Anti-Racist. And one of the things that he stresses, being a cancer survivor, he says that racism is somewhat like cancer to him. he says that they're both a disease. So we are facing two pandemics at the same time. One is COVID-19 and one is racism. And if we are to change this, we're going to have to look at systemic changes. You wouldn't go if you were being treated for cancer and say, just take out this one tumor. You would want them to look at your entire system to make sure that the cancer was gone. And you wouldn't be offended when someone said you were that you had cancer. You would say, well, how can I fix this? So I challenge our community to not feel offended if they should be told that, you know, there's racism or you are a racist. What your next step should be, what are my steps to heal myself? What are the steps I need to take to get better? So I will close with that. Thank you, all you fabulous ladies. I will say this, you follow orders like nobody's business. I thought we would get confused, but this was absolutely fabulous. I cannot say enough about you taking your time, and bless you, and everyone stay safe. So thank you so much.
Thank you.
Thank you, everyone.
Thank you.
Thank you.